Hello. Good evening, everyone. Today, we are going to have the Facebook Live on back pain after delivery. So this is we are using Global Circles Physio Rehab Facebook page to do this Facebook Live. But this is Parenting A to Z is a collaboration between Global Circle Physio Rehab, Cherish Postnatal Retreat, and also Good Deal Baby Shops to organize different type of parenting and prenatal workshops to help with all the new parents to overcome some of the difficulties when they prepare for the pregnancy and also after delivery. And this today topic actually is very special because it's talking about back pain after delivery, means after having your baby. Okay, so if you find that this Facebook Live is quite beneficial for your friends or for your family, please send this link to your friends and family so that you can share these good informations about back pain after delivery. So if you have any questions, you also can type in the chat box so that later I can answer your question. So this Facebook Live is about 45 minutes, and I'm going to chit chat about back pain after delivery. So if you have any question, you can just type in the chat box. And this Facebook Live is not only live in Facebook page, but it's also live at Global Circles YouTube channel, so you can see it at both sides. Okay, and can you give me some encouragement, give me some likes while you see this Facebook Live? Okay, and today we are going to talk about back pain after delivery and trying to break some of the myth, because I actually dealing with prenatal and postnatal mommy. So my name is Chloe. I'm a principal physiotherapist who have 15 years in this field, and just after my having two daughters, so I'm actually venture into women's health. So women's health is a specialty that is one of the specialty for physiotherapy to actually help with prenatal and postnatal mommy in their others in their musculoskeletal conditions or other conditions. So usually prenatal and postnatal mommy, they will have some like back pain, very common, and also some of the incontinence problem or diastasis recti problem. So actually all the while we've been doing the prenatal workshop, and last month we just completed our 6.0 parenting A to Z workshop. In coming September and October, we are going to have another round of workshop to help new parents or some second time having babies mummies, to help, and the parents to help them how are they going to prepare this pregnancy, and also the delivery and breastfeeding topics and others very good topics in our workshop. So without further ado, so I'm going to actually start today's topic. And can I have all the audience just type in the chat box? You can actually just let me know currently, are you pregnant, or are you just deliver or already deliver a few years? So yeah, so do you have any back pain currently? So back pain, what is the definition of back pain? So some of the mothers actually usually will have back pain is at the lower back. So a lot of people will think that it's just the lower back, but we can actually categorize it in different area. So back pain, we can start from the cervical at the top neck part. Usually this group of mommy having the neck pain is because of they have poor posture due to prolonged carrying of babies and also breastfeeding. Okay, another group of another area of common back pain is the mid back. Okay, so it's the upper back. part. So because of a lot of mommy carrying the baby, then they will have the hunchback posture. So they usually have the mid back pain. Okay, another one today we will more focus on the lower back pain. A lot of mothers actually have this low back pain is because of after delivery, so you all have weak core, and some of the mothers because of there's a prolonged delivery durations, like for example if you go for nature delivery, so somehow you all will have some actually your pelvic floor actually been stretched out and also pressing on your tailbone side. So some of the mothers actually having not only low back pain, means the lumbar region, but you all also have some pain over the tailbone region. We call it coccyxthenia. So another one is the sacroiliac joint, which is our pelvis bone connect to our tailbone area. Another one is the pubic pain. Pubic pain means the center part of our connection of our pelvic bone. Okay, so pubic pain is usually they for pregnancy they will be quite commonly happens in the pregnant group, but actually after delivery you all may have this different type of low back pain. So some of the mothers will come to me and then say that Miss Chloe, I have back pain. So actually usually we will try to check it out whether what is the specific location of the back pain, whether is it happens in the muscles area, or whether is it at the spine area, or whether is it at the joint area. Yeah, so and we need to identify what is the main cause, whether is it because of the muscle too tight, means the muscles of the low back pain is like holding up all the time, and then it will cause and it's caused by the hip area weakness also, or the hip area tightness, because nowadays a lot of mummies will, and they will tend to have the uneven pelvis area height. So some of them they actually come to me, and then I will check through the posture first, and also we will check on the pelvis level. So some of the pelvis level is like one side high and one side is lower, or one side is actually rotated, which means that is like a bit sag at one side. Yeah, so why does it happen is due to a lot of mummies or a lot of people actually don't really discover that you actually heavily rely on one side, and probably is due to when you carrying the baby, right, actually you tend to carry on one side, or you actually try to use your tummy to hold the baby more, so that's why your pelvis is rotated or sag at one side. So after carrying the baby for too long, right, so somehow you will tend to have tightness of the muscles on one side, and some of the mother will feel that the pressure on the spine is a lot on one side. That's why it will cause the back pain actually more on one side. Yeah, so if you having the like a tightness or the soreness of over the back is more on the one side, you may need to check it out whether is it because of how you carrying the baby. Okay, so this you need to take note of, and whether this kind of pain is it will be permanent. The first myth that we are going to actually explain to you is actually we just need to find out what is the main cause. Okay, what is the main cause of the back pain, and then the back pain is actually reversible, because we need to sort out the causes. Like just now what I mentioned is whether is it because the root cause is due to how you carrying the baby, and then it cause your muscles is more tight on one side, and you are actually put more pressure on one side of the hip and also the backbone. Then we have to find the root cause, what is the habits that you're always doing, and then treat treat the cause, treat the root cause. So actually we will do manual therapy for the back, and also trying to, and on the other hand is trying to correct the posture, that how you're carrying the baby, and then try to train your core muscles back, so that when you carry your baby you are actually engage your core better, and also how you're going to strengthen up your core muscles after your delivery. Yes. So actually the back pain is not permanent. Once you actually it's reversible, once you really need to find out where is the specific location of your back pain, and what is the causes of your back pain, and then you can actually reverse it. And how to usually we'll do manual therapy, and then after that we'll teach the mothers how to do some of the exercise that is important for you, because I know mothers usually don't have much time to actually doing exercise, and a lot of mother telling me that bo tiam sia, no time, busy taking care of the kids, is totally like very tired already, how am I going to do exercise? I understand how the mother feeling, because I also have two kids, and usually the exercise actually is targeting on engaging your core, and also trying to actually re-educate your muscles how to works and how to tahan in the good posture. So usually we will emphasize on the segmental control of the pelvis, and also your pelvis control, and also your hip muscles to trying to strengthen up, so that you can actually hold your pelvic region area stability better. Then it will helps a lot when you actually trying to carry your baby load, and also trying to carry the heavy loads a bit better. So this is how that is reversible, and we can actually through manual therapy and also some of the therapeutic exercise to help to reverse all these condition. Okay. Yeah, so if you have any questions, like for example, if you have currently you really face the problem that whenever that you carrying the baby you have some pain or some sharp pain, you have to really maybe consult a physiotherapist. The common situation is usually my clients actually complain to me is like when they bend down and trying to actually bring down the baby to the baby cot, or trying to carry them up from the baby cot or from the car seat, they usually have this kind of pain. So a lot of mummies actually just bending down the back, so like this. So you all tends to actually bending down, and without actually using your lower limbs to actually help out in carrying the baby. So actually I will advise you all to actually just do a squat, and when you actually lower down the baby or trying to carry the baby, and try to remember that you have to bring them close to you, and you just straighten up your back. If you doing this, it will cause less strain for your back, and it's actually is much more safer for your back, because if you're repeatedly doing this more often, it will cause your back to be easier strain, your muscle easier strain, and also there's a risk of causing slip disc as well. So you try to take note about it. Okay. And somehow a lot of mothers actually came to us during their pregnancy. So some of the mothers actually having this pain since their pregnancy already. So that's why you have to take note of how is your posture. The posture is a very key things that during your pregnancy and after your delivery. Okay, so now there's a first question from Serene. So if there's a back pain during pregnancy, will it go away automatically after delivery? Okay, this is a good question. Okay. Okay, so usually, right, we will actually check on the mothers whether they have back pain history before pregnancy, so means that they haven't pregnant and then any history of back pain. Okay, after that during pregnancy whether they have back pain or not. So some of the mothers actually because of the weight of the baby in the tummy, so it will cause increase the abdominal pressures, and also because of the posture, and then they will tend to actually keep on pushing their back forward and keep on loading at the lower back. So that's why they having the back pain during the pregnancy. And some of the mothers, about 20% of the mothers, actually they will have back pain going off, okay, after delivery. Okay, once the baby out and the pressure in the tummy is lesser, the back pain will be reduced. But there's also a group of mothers, actually the back pain is still continue after the delivery because of the weak core muscles, and also some of the back pain actually develop after delivery. It may actually because of the process of the delivery, and also another thing is because after delivery you all actually haven't recovered your core muscles properly, so you all need to really take note of how are you going to do the core muscles exercise after delivery. Okay, another actually myth is about epidural. So some I think we actually previously we've been discussed with Dr. Low before. Dr. Low is our one of our speaker for our workshop. So actually what he mentioned is and also actually from the evidence base, right, epidural won't cause back pain after delivery. Okay, a lot of people will have quite a sensitive spots over the lumbar region at the where the epidural drip insert in. So the part is quite sensitive, but it won't cause back pain. Okay, most of the back pain is really due to how is your posture and how you carry your baby and how is your recovery of your core muscles. So this is the thing. Another group of mommy will start to worry about, like for example, if they've been through C-section. Okay, so after C-section operation, because of because some of the C-section mommy will come to me and then ask me, Miss Chloe, can I how soon that can I do the postnatal exercise if I've been through C-section. Okay, so C-section they worry about because you need to cut through the levels of the levels of the abdominal muscles, and a lot of mummies will actually tends to be very cautious about the after operation kind of care. So for C-section, right, the main thing is some of the mothers will tend to be very fearful of the pain, so they will tend to actually brace it a lot, and also causing the tightness of the abdominal muscles or after delivery. And then they also didn't really engage properly their core muscles, their deep core muscles, we call it transverse abdominis, and this will actually actually causing the core muscles is not strong enough to hold on to the pelvis. Okay, and somehow some of the mother will adapt because they worry about pain, right, they will adapt a posture which is more like protected, so forward lean a little bit to protect the wound. Okay, and it will cause us a lot of tightness over here, over this region, or some of the mother will tend to like going behind, like trying to push the tummy forward, so a lot of muscles over here will get tight over this part. So for C-section mothers, usually we will advise how they are going to actually after delivery, how they are going to actually get out from the bed, and also how are they going to brace their wound for coughing. okay, and also how are they going to do some of the more on the static abdominal exercise to help with their recovery of their abdominal muscles without doing like sit up or those big movement that will actually causing a lot of injuries to the abdominal muscles. But for C-section mummies, actually there is a protocol that actually been recognized in American society. So we actually will go through the specific protocol to help with the mothers. How are they going to recover uh, uh, after the C-section operation? So currently actually I have mothers that's just came to me after C-section for 8 weeks. So after 8 weeks, we will actually assess how is the status of the wound, and also how is the core muscles conditions, and also how's the posture, everything. And after that, we will actually trying to check on the muscle strength also. So we will start gradual kind of exercise. So currently I'm one of the STOT Pilates instructors to help using reformers to help with the postnatal mummies to actually recover their core muscles. Okay, so the mothers actually did 6 weeks of the STOT Pilates reformers regime with me, and now she already go back to her work and also go back to her routine exercise that's actually help with her abdominal muscles to actually uh, able to actually carrying their baby a bit better, and also to cut down the back pain event as well. Yeah, so this is how that actually for for postnatal mummy, actually you all can actually consult a physiotherapist to actually plan out how are you going to actually recover your baby better, in a better way, and also especially for those that's having back pain problem. Okay, so you actually after delivery, if you have back pain, if you have incontinence problem, it's better to consult a physiotherapist so that to help with your those symptoms. And this is actually able to reversible, and is good to actually treat it earlier, especially you are in maternity leave, because a lot of mothers actually they tends to they concentrate on their baby first, they without thinking about their own health. So back pain and also incontinence actually will actually cause a bit of worry about for the mothers, especially after they return back to work, okay, workplace, or they return back to their community. So this is actually very important to take note of, especially if you have leakage of urine, or if you have back pain after delivery. It's good to consult the physiotherapist to help with your symptoms, especially these two symptoms. And usually after actually doing manual therapy and also doing the targeted exercise, right, usually 3 to 4 sessions, actually the mothers actually if able to remember and also to kind of re-educate the muscle well, actually usually the symptoms actually will cut down, unless there's more complicated cases, like for example uterine prolapse, and also with some other conditions like the core weaken a lot. So this is the main tips for you guys. And there's one mothers actually came to me after the 2 years, about 2 years after delivery, and she told me that she actually restart her own exercise, but after that she had the knee pain and also back pain. So she restart her running activities after 2 years of resting, didn't do anything, and she restart her running. So after that she had because of she didn't prepare her body well, so she actually injured her knee and also her back after, because her she also have diastasis recti, which is 3 fingers. Okay, so that's why we will actually check through how is the status of the mothers before we actually advise them back to their sports activity, which is more aggressive. And because if the core is weak, so it will cause a lot of problem over the pelvis region, and also stress on our back, and also some of our lower limb joint. So please take note of that. Okay, so any questions you all can ask. Okay, and in the YouTube and also in the Facebook live. Okay, so this is a quite a good topic to discuss, because actually you heard about like your friends and your family will tends to have this kind of complaints after delivery. Okay, so there's a condition actually I need to highlight to you all. So there's one mother came to me, and she actually just delivered post 1 month. Okay, and her back pain is quite unique, because she feel that the tailbone, the whole tailbone is very sore and very pain, and also affecting her control of the urine, because she find that she very hard to pee. So this group of mommy is actually because of the pelvic floor cannot relax and getting tense up, and also it's also related to the tailbone the muscles that's nearby the tailbone there, and also deep pelvic floor muscles. So for this group of mommy, we'll actually we will focus on actually how are we going to use manual therapy to help with the specifically to the tailbone, the coccyx region, and also pubic region. Then we also will actually teach them how to do the relaxations of the pelvic floor instead of doing the Kegel muscles exercise only. So a lot of mothers here, if you listen to this Facebook live replay or anything, you have to take note of when you do the Kegel exercise, right? You have to remember not just squeezing only, but you have to squeeze and relax, because a lot of mothers if they tends to have like urge incontinence, or they cannot control their urine very well, like somehow it is due to the pelvic floor muscles don't know how to relax and contract effectively. So this is one of the very important point that you need to take note of, and it's better to consult a physiotherapist who specialize in women's health, so that to target on your needs of target on your problem, and also try to sort out the problem as soon as possible. Okay, so the third myth that today we are going to talk about is nothing you can do to reduce back pain. Actually a lot of people will think that why my back pain is keep coming back. Okay, and also there's nothing I can do to actually help with back pain. Okay, this is not true, and this is not a fact, because actually for back pain wise, we like just now what I say is we really need to find out what is the cause. Okay, and also the cause is not only we find out where is the region of the pain, whether is it the upper back, lower back, tailbone, pubic bone, or sacroiliac joint, or whether is it related to, we also need to find out which motion or which are the habits that is causing you the back pain, especially for postnatal mommy. The thing is you are doing the motion repeatedly, like carrying the baby, breastfeeding, bringing the baby in and out from the car seat, need to play with them on the floor, and also pushing the strollers and everything. All these are a repeated movement. So we have to really target on how you do the motion, and also give the advice accordingly, and then we have to retrain the muscles that help you with the movement. Okay, last time I have a mummies that is actually have a tailbone pain whenever she push the stroller. However, she felt that the stroller is not really heavy. Actually, it's just the baby inside and pushing the stroller. So that's why we have to see how she push and also see what is the motion that causing the pain. So after doing manual therapy and teach her how to actually engage the core, the pain actually gone off and doesn't really come back again. But because some of the mothers actually doing the motion all the time, and somehow you may come back maybe after a while. Okay, so usually our approach is after treating the pain, okay, settle down already, then actually we can actually cut down the review frequency, or we actually open date. And for mothers, you all will tend to very busy with your work and also your kids. So then once you have the new problem again or same problem again, you all will come back to us again, and then we review again. So this is how. And the main thing is the main message that today I need to actually mention is, mummies, please take care of yourself, because you need to take care of your baby. So if you have pain, you are going to be frustrated, right? And also it will actually affect your how you going to take care of your baby also. So we always emphasize that healthy mommy, happy baby. So once you have pain and the pain is last for more than 1 to 2 days already, so don't tahan for longer. Better sort it out earlier so that the pain won't be so chronic. Yeah, and if you drag it for longer period of time, right, the pain or the stress or the injuries that happens in your joint, right, it will going to be more serious, and it is better to treat it earlier. Because if you treat it earlier, actually it's very fast, you can sort it out. If getting more chronic and chronic, then it will cause more problems. Okay, just that there's some mothers that is actually some of the back pain conditions which is more complicated, and why it's become more chronic is because of there's an involvement of the nerve. Okay, if the pain it's just sharp pain and also during some certain movement, not all movement, this group of the clients actually we can actually try to sort out very as soon as possible, sort out your pain as soon as possible. But if your pain is accompanied with some radiating pain, means like the pain is shooting down to the legs, or you feel numbness over your calf or your foot or anything, that's actually involvement of the nerve already. So we have to identify actually whether is it a nerve involvement, or is it a disc involvement, means that there's a probability of the slip disc over the spine root, the nerve root region, or there's a involvement of the spinal cord itself also. So all this we actually will advise accordingly, and we will actually assess accordingly, so that we can actually try to find out what's the root cause. And also somehow we will actually try to ask you to consult your orthopedic doctor if needed. Then we can actually pair up with what's the medical management, and also what's our physiotherapy management. So this is how that we manage our case more holistically. And also we want to actually try to sort out the pain as soon as possible, and try to tackle the root cause, especially for back pain after delivery. Okay, so if you have any questions, you actually can type out in the chat box. And also you can actually ask, if you're watching this replay, you also can actually just message us, and we can actually answer your question in a later message. Yeah. Okay, so because this topics is actually about postnatal delivery, but somehow so that's why postnatal back pain actually is able to prevented can be prevented if during your pregnancy you are actually more aware of your posture, and also you can do some of the exercise that actually help out with your posture and prevent your muscles tightness, and also maintain your pelvis mobility and also stability to help you with your posture during the pregnancy, so that after delivery actually some of the back pain can actually prevented. Okay, so that's why a lot of mothers, you all can actually try to look into it. How are you going to prepare your body for your pregnancy and also after delivery? If you prepare your body better during the pregnancy, then after delivery your recovery is actually much more better, and your postpartum problem can be actually reduced. So that's why this is my advice for you all. And it's very important that to actually sort out the problem as soon as possible. If you have back pain during the pregnancy, actually you can consult a physiotherapist. The physiotherapist is actually trained to actually treat pregnant women, and also there's some manual therapy that's suitable for pregnant ladies. And also after delivery actually you have to really try to sort out, because I know that mother's routine is every day you need to take care of your kids and also your works or your housework, everything. So if you are suffering from pain, back pain or any other pain, then it's very hard for you to continue your routine as well. So every time I will actually advise the mothers, try to sort out, don't drag more than 2 days or more than weeks, so that you can actually recover faster. Okay, and there's also one of the questions that commonly we will have is, when you have pain, whether you need to apply a hot pack or cold pack. So this is a very kind of confusing questions that always asked amongst the mothers. So if you have back pain, or if you have neck pain, or if you have the mummy's hand, so you actually need to feel the skin, whether is it like you feel the warmness over there. So if warmness means that there might be inflammation going on over there, over that region. Okay, some of the muscles or some of the nerve root, there may be some inflammation. So you actually can put apply a cold compress. So you can use those gel type of cold compress, or the putting the ice one. So you actually put there, apply there with a layer of towels. Then you can actually apply for 15 minutes. Okay, if you find that the muscle is like very tight, like very sore, and there's, when you feel your skin, actually there's no warm, not really warm, so you actually can try to put the hot pack to loosen, to actually loosen your muscles, so that you can actually feel better, not so aching, not so tight. But trying to do some therapeutic exercise to help you with your movement, so that your muscles won't be always like very hold it tight over there. But definitely you need to do some core exercise to strengthen your muscles. Okay, then the next thing is, some of the mothers, like during pregnancy or after delivery, and still breastfeeding, you all are worried about can I eat painkiller or not, or can I put the painkiller pain relief patch or not, because the medicine will it's not so suitable for pregnant women and also breastfeeding. So for you all, you can actually consult the pharmacist and check on them. Usually the Panadol, there's different type of Panadol. So it's actually some of the there's a one type of Panadol is actually suitable for breastfeeding mummies and pregnancy. Okay, another thing is if you want to be actually relieve your pain, uh, you can actually choose to use the pain relief patch, which is actually transdermal and is not go by our bloodstream. So you actually can actually help out with relieving your pain over the muscles region and also over your joint. Yeah. So this is some of the tips that helpful for you all to especially for back pain after delivery, and some of it is related to your pregnancy. So please remember, take care of yourself, and healthy mommy, happy baby. So you actually remember that posture, okay, and also you can actually try to do some exercise to help with your back pain, and also your core muscles to strengthen up so that to prevent the back pain keep on coming back. And third thing is treat it earlier, consult a physiotherapist to help with your condition so that it won't drag, and also it won't causing the chronic problem. Okay, so these three tips is the main thing that actually today I want to deliver and actually let you all understand. So if you have any question, you still can contact us through the message. And also this Facebook Live and also YouTube is going to share it out in another page called Parenting A to Z. It's a new page that's related to parenting and also breastfeeding, and also pregnant information. So you can actually take note, can follow the page Parenting A to Z page. And then just want to update you all. So in 22nd of September, we are going to conduct the online webinar. It's done by our new dietitians, Xingyi, and pediatricians, Dr. Chong, and also Winnie, and the financial planners, and then the Prof Chua is talking about nutrition for the nutrition for the baby. So these are the 4 topics, and followed by our another 3 workshop, which is the physical workshop. So this time round we are going to have separate our physical workshop in 3 different days, so that the mummies, the parents can absorb a bit better, because after this is our 7th round already, and after doing for so many rounds, actually we collected feedback from mothers, and we found that you all are actually very keen for learning, and also you all want to understand a bit in depth. So this is how our prenatal workshop is different from others prenatal workshop, that actually we are going to concentrate on the in-depth informations that you all need, and also the practical part that you all need as a new parents, or as a parents that's welcoming the newborn baby. Okay, so our workshop is actually in physical workshop is going to be on October. Okay, on October, let me see. So we are going to disseminate the information soon, so please stay tuned in our Facebook page. And also if you want to know more about prenatal and postnatal exercise, you can actually contact Global Circle Physio and Rehab. This is our page, and we are going to see you all soon. And next week we are going to have some Facebook Live also. So we are going to conduct routinely Facebook Live on Sunday night, so you can stay tuned in our page. Okay, so thank you everybody, thank you.